This is time now for the health segment. Today we'll be talking about maternal child health and nutrition. So if you have any questions, please let us know. The hashtag is Breakfast Daily and the WhatsApp line is 0550-585832. It's really important that we talk about maternal health even before the woman starts to think about getting pregnant. That's where it begins, throughout her pregnancy and of course the life of the child. I have with me Mr. Felix Okudugu, who is a senior technical officer of health promotion at the Ghana Health Service. Good morning, Felix.
Good morning.
How are you?
I'm fine.
Thank you so much for being with us. Now, maternal child health and nutrition, what can you tell us about it?
Okay. Good morning to your cherished listeners. When you talk about maternal child and health, nutrition, we think about the welfare of the mother and the child, the newborn baby. That's what you think about. And you think about, because when a child is born at the early stage, the first 6 months of his or her life, she or he needs to be on the breast milk. And after that, we introduce the child to a complementary feeding. So we think about all those things and we fix them appropriately so that the mother will also get the needed nutrition requirements so that it will give her the kind of strength that she needs to continue with her life.
So when does maternal health actually begin for people considering to be mothers who are watching us? When should they actually start that journey?
Okay, so immediately you have the idea to just conceive, it starts from there. So you plan the number of children you want to give birth to and when do you want to give birth to them, the intervals, you plan about all those things. So if with those things, you see your medical officers or nurses, then they will take you through all the available services so that you choose the one that will be appropriate for you.
Okay, so how will the experience of motherhood be different for a woman who prepares, engages health professionals throughout her pregnancy from one who does not? Okay,
with the one who engages the health services, she will have the information and what to do as and when is necessary. And most often, they become healthy, and they give birth to healthy children. And it also reduces maternal and child mortality. Unlike those who do not seek at all, they always come at a later stage with a lot of complication, which also results in death, which we, Ghana Health Service, is preaching against it. So we encourage every woman, the moment you have the thought of conceiving, go and see your medical officers. And the moment you conceive, also continue the service until you deliver.
Now, what are some of the specific support women will get once we make that step?
Okay, so one thing, we have a counseling.
Okay.
We take our time to counsel you, know your situation. Based on that, we counsel you and things that you are supposed to do. We also talk about feeding.
Okay.
What you are supposed to eat, what you are not supposed to eat. And also talk about exercise, the things that you are supposed to do as exercise and the things that you are not supposed to do. And also take them through a laboratory investigation to know if they're having some disease that we need to treat it so that it don't have effects on the child.
How crucial is nutrition when we talk about maternal and child health?
Okay, for nutrition is a very important thing when it comes to maternal and child health, because there's no way you can talk about health without thinking about nutrition, because our immune system is developed from the kind of nutrition that we take. If you talk about immune system, we think about our blood, and you know we develop our blood from the food that we eat. So nutrition is a critical aspect of maternal and child health.
And what are the things we should think about eating? Because there's a lot of myths around what even a woman should eat when she's pregnant, what she shouldn't eat. Can you shed some light on it for us?
Yes, we have individual specific needs when it comes to nutrition, because some people have tolerant to some kind of food and some don't have it. So I just don't want to just give a general, but once we come to the health service, we sit down with you and know that is not healthy for you, then we plan towards it. But most often we talk about vegetables and fruits. We talk about it, and also whole grain foods. We talk about those things. So those should be at least something we should build on. And coming to specificality, we talk about when you come and see the nurse, he or she would then sit down with you and then plan your meal together.
What are some of the challenges that may prevent women from going to get the care that they need?
Okay, Most often, let me put it in three phrases. I'm talking about the government sector, the health sector, and then the individual. When you talk about the government, the accessibility to health service and also affordability. We know that most of our villages do not have health services, and also the few that have it, the women cannot afford the service, some of the services, so they tend not to go at all. And when it comes to the health sector, we all know that we have some bad nuts among.
Yes.
So you go, the attitude of the nurses.
And your bad nuts are very bad.
Will turn the women away. So that's one aspect of it. And also, when it comes to the women themselves, sometimes they believe in unskilled, or because of cheap labor, they would rather go to people who are not trained and they're in the community, and they take themselves to be a midwife and then do the delivery. So that is what causes.
So on a governmental level, what are the things you think we should do to ensure that at least we decrease maternal and child mortality in the country?
Okay, Ghana in the year 1995 adopted CHIPS, and it started from Navrongo, and I think CHIPS is helping because most of the villages that do not have hospitals have CHIPS, and the CHIPS, we have trained nurses there who at least will assist you and give you the basic
things you need.
Yes, so that when it's time for you to deliver, they refer you to where they think is appropriate for you. So I believe we have to increase the burden of CHIPS in almost all the communities.
Okay. How do we also ensure that health care for mothers are a bit more affordable so that the most vulnerable amongst us get easy access?
We talk about national health insurance. In fact, we always advise people that they say that it's not even needed to have national, because when you go to hospital, you still pay. But I always advise them that when you come to a health facility, now consultation and card alone will cost about 30 cedi. And how much do you pay for national health insurance for the whole year? It's 24 Ghana cedi. So going to pay for only a card and consultation is costing 30 cedi for one attendant. Why don't you use that money, part of it, and you get even change to acquire yourself a national health insurance, which will pay for all those things.
So the national health insurance will pay for everything that we'll get from our OBGYN, for instance. Would it also cover the medicine? Would it cover the entire process for us before the 9-month and then once the baby is out?
Yes.
Okay, so you really want to advocate for more mothers to get on the national health insurance. Okay, on the perspective of the healthcare worker, how do we get them to be a bit more empathetic? Because I have friends who are even like single mothers, and the kind of stigma and experience you will go through at the hands of the health workers can turn you off from going to get the care that you need.
The Department of Family Health have started a program on client care.
Okay.
And we are still training our nurses how to be a little bit sympathetic when the clients attend for their services. So we've started something, but we haven't gone far. So I believe with time we'll get there.
And speaking of engagement, you have an event coming up. Do you want to tell us a bit about it?
Yes. On the 11th to 13th of this month, the Family Health Department of Ghana Health Service is going to organize a conference, and the theme is Sustaining RMNHCAH and Nutrition in Service Delivery.
What's RMNHCAH?
R means reproductive, M maternal, N is either neonatal or newborn, and the C is child, A is adolescent, and H is health and nutrition in service delivery and resilient health care service.
What's the conference about?
We want to engage all the stakeholders and then plan the way forward, because of the COVID, now we're having a lot of challenges. Our stakeholders, those who are our donor partners, even if they have the money, it's not enough to take off on their own. So we want to sustain the program, whether with them or without them, or the little that we have, we want to sustain. And also in 2019 and 18, we developed a road plan for the next 5 years, 20 to 2025. We also revisit it and see whether we are doing well or we are not, what we are supposed to take it out, what we are supposed to add on. We are going to think about that one too. And also engage all the stakeholders, what they need to input to make us achieve our SDGs.
Nice. So what's the theme for this year's conference?
Sustaining R, M, N, C, A, H, and nutrition and resilient health service delivery in emergency and beyond.
As a nation, how do we get to a point of sustainability? From what you're saying, we can't always depend on donor grants to sustain these things. So what's the mindset we need to have moving forward?
Okay, we are first, this thing will be, we have to focus on the available resources that we have in, and then also the strength in our community. So we have some benevolent people in the community or in the country who also can come and support. It's not all the time that you have to get it from outside the country. We have people in, during the COVID time, when we asked of benevolent organizations to come and support the COVID fund, we also what went on. So I think we should also engage those people to help us build our health to where we want it to be. And also, if you travel outside some countries, most of the health facilities belongs to the individual, not the government. So if we can also develop that aspect of it, so where we allow individuals to also come on board and start building health service at where in the villages where we don't have the health service or we don't have health facilities, to also help in combating disease and also uplifting the care for mothers and children.
So when we look at the different stakeholders, the government, the health professional, as well as the mothers, what do you hope you'll be able to achieve at the end of the conference?
Okay. With when you talk about the government, we are seeking for the support of the government because still we don't have enough health workers. So government should recruit more nurses into the system. And when you come to the Ghana Health Service, those of us already in it, we are putting in place measures to make sure we give out quality service that the mothers will also need and always seek to come back for our services.
And then the mothers themselves?
Well, the mothers, what we are saying is that whatever we tell them during the service or when they come for our services, they should listen to us and also abide by it. They shouldn't go and then listen to the roadside drug sellers who convince them, or also go and resort in concoction and traditional. I'm not saying that traditional medicine are bad. No, I'm not saying that. But those that have been approved, they can do, and it should be recommended by their medical officer. It shouldn't be on their own that or a choice that as they are going, somebody will just convince them, they just take money and go and buy and then start using. It should be a recommendation from the medical officer.
So who are the people that should participate in this conference?
Okay, this year's conference, because of the COVID in mind, so we are inviting 3 people from each region.
Okay.
They are coming, and the rest of us will join on all the social media, Ghana Health Service social media handle.
Nice. Remind us again the day, the date, and the time.
Okay, we are starting on the 11th of this month to the 13th of this month at Labadi Beach Hotel. That's where the meeting is taking place. And as I'm saying, we are inviting 3 people. In fact, it's strictly by invitation. 3 people from each region, all the 16 regions. And the rest of us will join through Zoom, Facebook, and all the social media handles that Ghana Health Service operates with.
So for those of us who will join via Zoom, do you have the Zoom link, or do you want to share a number or the social media handles for us to log on to when it's time?
Yes, we will provide that when the time is up.
Okay, and is there a number to call for more information?
Yeah, I don't have the number of an number.
Okay, but is there a social media page we can follow?
Yes,
so that we can
Ghana Health Service.
So just go to the Ghana Health Service page and we'll find everything.
Yes, please.
So wrapping up for us, when you look at the maternal and child help space in the country right now, how far we've come, how far we need to go, what would you say we all need to do to get Ghana to a point where we have 0 maternal and child mortality?
Okay, with that one, I'll still go in the 3 steps where we have the government, the health workers, and the mothers. With the government, we need to open up or expand our health facility, and also take it to where we don't have some. And also, one thing is the ambulance service. Ambulance, when it comes to maternal health, ambulance service very, very important. They should also widen that one up. And when it comes to the Ghana Health Service, what we need to do is that we continue training the nurses to be professional in discharging their duties. And also when it comes to the mothers, they should also attend to ANC as early as when they get to know that they have conceived, they have taken
What's
seed.
ANC?
Antenatal care.
Okay, so as early as
Immediately you get to know that you have taken seed, you have to seek your medical professional to advise you what to do. And also we have to visit skilled, it's only skilled people. We have unskilled or untrained people in the community. I'm talking about those who have been trained and certified by Ghana Health Service. They are the people that we have to seek our services from.
Thank you very much, Mr. Akodogo Felix, for being with us and really helping us appreciate the fight and the progress we've made in the maternal and child health space, as well as nutrition. And we hope that all of our viewers will join the Ghana Health Service on the 11th to participate in the conference. And of course, we will all join via Zoom because we're only getting 3 people in every region in the country. Thank you for being with us. And Mr. Felix is, of course, a Senior Technical Officer of Health Promotion at the Ghana Health Service. It's really important. We need to get to a point in our development where we are not losing our mothers, we're not losing children because they are not getting the adequate care that they deserve. And this conference is going to help us really understand what all 3 stakeholders need to do, what more the government needs to do, what the mothers themselves and of course the fathers, the family of the child need to do, and then finally our healthcare workers, the role they play in decreasing maternal and child mortality rates in the country.